Roth wrote in Nutrition and Diet Therapy that diabetes mellitus is a chronic disease that develops when the body does not produce sufficient amounts of insulin or does not use it effectively for normal carbohydrate metabolism. Type 1 diabetes is when the body doesn't produce the insulin. Type 2 diabetes is when the body doesn't use insulin in the correct way. Type 1 and type 2 diabetes are serious illnesses that affect many people. Diabetes can happen to anyone. Roth wrote in Nutrition and Diet Therapy that 25.8 million people in the United States have diabetes. An estimated 18.8 million people have been diagnosed with the disease, and 7 million more are going diagnosed. That's a lot of people with diabetes. But a lot of this can be due to genetics, which mostly people with type 1 diabetes, that's their issue. Nix wrote in Williams' Basic Nutrition and Diet Therapy that type 1 diabetes mellitus accounts for 5% to 10% of all cases of diabetes. This is when their insulin isn't produced. Staff wrote in Diabetes that your risk for diabetes is higher if your mother, father, or sibling has diabetes. This is because genetics play a huge role. But another thing why a lot of people have diabetes is because of their poor diet and their lack of exercise. Nix wrote in Williams' Basic Nutrition and Diet Therapy that approximately 90% to 95% of individuals with diabetes have type 2 diabetes. This is not a good thing. That's a lot of people, especially since millions have it. Staff wrote in Diabetes that obesity is the single most important risk factor for type 2 diabetes. And a poor diet is a lot of what can make people have obesity, because they're eating these foods that are really high in like cholesterol and stuff and carbohydrates, so they're gaining a lot of weight, and if they don't exercise, that weight's just going to stay in their body. And diabetes can also cause many other serious problems, stuff like nerve damage. Staff wrote in Diabetes that with nerve damage, you may lose feeling in parts of your body or have painful, tingling, or burning feelings. This can lead for a need for amputation, because if you can't feel your feet, something can happen to them, and an infection can grow, which will lead for the need to amputate those feet. Nix wrote in Williams' Basic Nutrition and Diet Therapy that current estimates are that 60% to 70% of people with diabetes have mild to severe forms of nervous system damage. That means people really need to be checking their feet. Nix wrote in Williams' Basic Nutrition and Diet Therapy that cardiovascular disease is the major cause of death for people with diabetes, and it occurs 2 to 4 times more frequently in this population compared with the general population. That's because their insulin's not working, so the foods, the cholesterol is not good for their bodies, and so that's why they need things to help them. The National Institute of Diabetes and Digestive and Kidney Diseases wrote in Diabetes, Heart Disease, and Stroke that people with diabetes are also more likely to have certain conditions or risk factors that increase the chances of heart disease or stroke, such as high blood pressure or high cholesterol. That is not a good thing, because high blood pressure and cholesterol can lead to heart attack and stroke, which can lead to death. That is why diabetes is not good, and it's a terrible disease that many people have. Diabetes can, however, be prevented or regulated. A good diet and with some exercise can help with that. Next wrote in Williams' Basic Nutrition and Diet Therapy that because type 2 diabetes usually occurs in overweight adults, A major goal is weight reduction and control. So controlling the weight is very important since obesity can cause diabetes or lead to it. Staff wrote in Diabetes to eat a variety of healthy foods, avoid foods that are high in fat, cholesterol, salt, and added sugar, and maintain a healthy weight and be physically active on a regular basis. This can help prevent diabetes. But for people who have things like type 1 diabetes, they don't have really anything to prevent that. So medications do them a lot of good, but medications can also help with type 2 diabetes. Staff wrote in Diabetes that insulin therapy is necessary for all people who have type 1 diabetes and for some people who have type 2 diabetes, because they need that insulin since it isn't working for them. Roth wrote in Nutrition and Diet Therapy that clients with type 1 diabetes must have injections of insulin every day to control their blood glucose levels. They need that insulin to help them break down the food in their bodies. Otherwise, they can go into it's a coma that they can go into, and that can also lead to death. Diabetes is a serious illness affecting many people. However, it can be prevented and regulated as long as people take care to realize that they have diabetes or they realize that it can happen to them. In the article from Journal of Patient Care, it considers diabetes a debilitating disease. This is because a lot of things can't be done for people with diabetes. They can't really drink alcohol because it'll affect their body in a way that they can't break it down. They also can't eat certain foods that are high in cholesterol because it can lead to them having a heart attack or stroke, and that can lead to death. So it's very important for people to regulate and prevent diabetes.